My name is Jen Goebel, and I have the privilege of serving as the athletics director here at Thomas Worthington. It is an absolute pleasure to welcome Governor DeWine and Dr. Bruce Vanderhoff here to Cardinal Country this morning. The last 15 months have presented unprecedented challenges for those of us who work in high school athletic administration, and I really appreciate the executive director of the Ohio High School Athletic Association being here this morning, Mr. Doug Ute. And I also am excited to be joined by fellow coaches and student athletes from throughout Central Ohio today. Thomas Worthington was one of the first high schools in the state of Ohio to hold a vaccine clinic for our students, and we will continue to partner with Columbus Public Health and Nationwide Children's Hospital to be a host site to administer the COVID-19 vaccine. We're very proud of the high vaccination rates within our community, and from an athletic standpoint, I am just thrilled that our vaccinated student athletes and coaches will be able to enjoy their athletic seasons next year without the looming fear of quarantine or their seasons being canceled. I really appreciate the opportunity to have everyone here at our school today, and it is my honor to introduce to you Governor Mike DeWine.
Thank you very much. Jen, thank you very much. I told Jen a moment ago that of all the jobs there are, athletic director has got to be one of the toughest. All parents are happy today, right, Jen?
They're always happy.
Everybody's happy. In all seriousness, this has been a tough year for our schools. This has been a tough year for our students, tough year for parents, tough year for teachers, and certainly tough year for anyone, a coach or athletic director who's tried to navigate and get a season in. It's been very, 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 very tough. So Jen, thank you for what you do and other athletic directors across the state. I appreciate very much what the Worthington schools have done. You have partnered with our health professionals, Nationwide Children's Hospital, Columbus Public Health, to host vaccination clinics for your students shortly after the eligibility was opened up. And so we appreciate that real leadership by the school and leadership by other schools as well. This just has been a very, very difficult year. We have seen athletes who have had to quarantine, athletes who have lost seasons, athletes who have lost games, teams that have lost their ability to make a run for the championship, and that is just heartbreaking. It's heartbreaking for parents, it's heartbreaking for the young people, and certainly heartbreaking for their coaches as well. This year is different. We have a tool now that will almost guarantee, when it's used, that teams will have a full season, that athletes will be able to compete, and their biggest worry will not be COVID. Their biggest worry will be the team they're preparing for or the athletes they're preparing for to compete against. We want our young people focused on that and not focused on the COVID. And the tool that we have, of course, this year that we did not have last year is the vaccine. The vaccine is our ticket out. The vaccine is our ticket for a full season. The vaccine is our ticket to allow our athletes to live up to their dreams and to play a season and to compete. But it's not just for the athletes. If you're in theater, if you're in debate, whatever your passion is as a student, your ability to compete, to enjoy that season, to enjoy that competition, to enjoy whatever it is, whether it is the arts or sports, whatever is your thing, the ability to have that year and have a good year really depends on getting the vaccination. So it's our ticket out, it's our ticket to freedom, it's our ticket for the athletes to have a season and for everyone else, for them to have a good academic year, but also to enjoy the extracurricular activities that frankly motivate so many of our students and make their high school, junior high career extra special and give it real meaning. So we're going to hear today from some coaches. We're going to hear today from some athletes about this. So let me start off with our first speaker. Joining us today, I'm going to actually introduce some of the people that are here. Some will be speaking, some will not be speaking. Joining us today, Ohio High School Athletic Association Director Doug Ute. The Ohio High School Athletic Association has done a very phenomenal job. They really have been in touch with our office, and we've worked with them and worked with the Lieutenant Governor John Husted. Worked many times on a day-by-day basis as we've tried to navigate this. So I want to thank Doug. I want to thank his team for all the great work that they have done. And let me now introduce Doug Ute. Doug, thank you very much. Thank you.
Well, thank you, Mr. Governor. Appreciate the opportunity to be here. And Jen, thank you for hosting this. And Jen represents well over 800 athletic administrators in our state by being here. And let's thank you for what you've done this year, because I echo the governor's sentiment. I've been a teacher, coach, and athletic director, a high school principal, and for 20 years a school superintendent. And being an athletic director on a normal year is a very challenging position to have in a community, and this year it was extremely challenging. So Jen, thank you and all the other athletic directors in the state for making this past year success. I heard a superintendent speak at a graduation this year that told his students they didn't just survive, they thrived. And that hit me on this past year in the state of Ohio, not just with athletics. We didn't just survive, we thrived. And so, I would point out to the students over here, the student athletes over here, that I've had an opportunity to watch some of you play at state events and those type of things, and I can't imagine not having that opportunity for just under 400,000 student athletes in the state. And so I do want to extend our appreciation to the governor, Lieutenant Governor, Department of Health, for working with our association this year and realizing the mental health benefits of what they do beyond the other benefits you get by being on a team. And so moving forward, the absolute number one question I get, and I started getting late winter from school administrators and parents and student athletes, what do you think the fall will look like? Well, I think we saw a glimpse of that this spring by the attendance and those type of things at our events, our state events, which were just finished off. But my hope was that a school bus would pull up to a building and 50 or 60 students would get off the same bus. They would eat lunch together. They'd go out on the playground and play together. And on Friday night, Jen and her peers would open up the gates and the whole community would come in, those of us that want to come in to watch. And let me take an opportunity to share how important it is for a community to get behind their schools and their student athletes all the time, but particularly this coming fall. And so encourage our community members to get out to the events. But we kind of hold that right now. We hold that key to that success of our fall right now. And the governor said it so well. It's more than just athletics. It's fine arts. It's the math class. It's everything associated with the school. And we know, and we talk a lot about this. We're an athletic organization, but we also know the importance of marching band and choir and those type of things that give kids a sense of belonging and teach them teamwork and those type of things. And so I encourage everybody to take that next step and do what the governor is asking and provided for us, and take that next step and get that vaccination that will keep everybody safe. And we can go back to a football sideline where kids aren't 10 feet apart and let them jump on each other and share that, and let them get in a car and go spend a weekend at somebody's house, and all those type of things. And so just have an appreciation for the governor's leadership this past year, and allowing us to allow our student athletes to have their opportunities, and so just appreciate that, and thank you very much.
Doug, thank you very much. Let me now introduce the Ohio Department of Health Chief Medical Officer Bruce Vanderhoff. Bruce?
Well, thank you very much, Governor and Mr. Ute. First and foremost, I want to reaffirm that the vaccines that we have available to us are safe and they're very, very effective. And I want to remind everyone that they were developed in a way that assured that absolutely no corners were cut in their development. The development of these vaccines, which are truly remarkable vaccines, entailed all the usual safety steps. The safety steps that we would see, for example, for vaccines that I think have become fairly commonplace: measles, polio, whooping cough. And these are all conditions that prior to the introduction of vaccines really impacted large numbers of people, not just in Ohio, but across the country. Vaccines, quite simply, save lives. They're critical. They are the way that we are able to contain the spread of dangerous diseases, and COVID is in that category of dangerous diseases. Here in America, we are now blessed with having what is truly the Cadillac of vaccines. Vaccines that are unquestionably safe and effective. And the Pfizer vaccine, of course, has been approved down to the age of 12. So people 12 and up are able to receive that here in Ohio. As the governor indicated, these vaccines really are the best protection for all of us who are able to receive them, especially in a world where we're seeing more and more variants arise that are more and more contagious. Think about, of course, the variant we've been dealing with here in Ohio and across the country, the B.1.1.7 variant, and now you hear in the news reports the global rise of the Delta variant, which appears to be even more contagious. And your best protection against that is vaccination. Now, as I noted, we really are fortunate to have access to terrific vaccines that are safe and effective, and as the governor noted, really are going to protect you. They're going to assure that you can plan to live your life as expected. But we know that there are people in Ohio, especially those less than 12 years of age, who simply can't be vaccinated. And we do have to think about them as well as the small percentage of Ohioans who are not able to be vaccinated for some other reason, perhaps due to a problem with their immune systems. Well, the COVID vaccine is really important for every age group. One of the concerns that we have raised by people sometimes relates to, well, you know, young people, they're likely to have a relatively mild course of COVID-19. And that is true for most, but it misses the point that there are severe complications that impact some young people, including the multi-system inflammatory disorder of children, MIS-C, a very, very severe condition that can hit children without any way of predicting which will be hit by it. Causes severe inflammation of organs, including the heart, the brain, the kidneys, and lands these children in the hospital in a very serious condition. There's also the concern in the public health community that if there are pockets of our state where vaccination rates are low, we could see mini surges of COVID-19, particularly as we head into the fall. And those mini surges will undoubtedly be associated with hospitalizations and deaths. So, parents, teachers, guardians, coaches, teammates, you have an opportunity. Vaccinating yourself is, of course, the best way to protect yourself, but it's also the best way to protect a lot of other people you care about, including some young people who you're interacting with throughout the school day or perhaps even in the course of your athletics. So we're encouraging every Ohioan who is eligible to get vaccinated. Not just because it's the important step to assure that as we head into the fall, we're going to have the band season, the sports seasons, be able to plan on having a school play, but also because you will be protecting many of the younger students who right now are not able to be vaccinated from this illness, as well as vulnerable people in your community. So, Governor, I'll turn it back to you.
Thank you very much. Doctor, thank you very much. Now I'd like to take a moment to recognize our students and our coaches who are here. You'll be hearing from some of them, but as I've told them, all of them will be available if anyone has any questions. So let me start. Joining us today is Tate Beagle, student here at Thomas Worthington. She plays field hockey and lacrosse. Good. Also from Thomas Worthington is Aaron Lees, who runs cross country and track. You want to stand up? Let's see you. Come on. Thank you. Thank you very much. Bishop Watterson High School, we have Molly Griffith. She plays field hockey. Molly. We also have Christian Bird, a basketball player from Independence High School here in Columbus. Next is Caden Saunders joining us from Westerville South High School. He plays football. And Cameron Kist is from New Albany High School, where he plays soccer. Appreciate all of them joining us. And we have a few more from Pickerington Central. We have J.J. Burroy. Also Pickerington Central student Sonny Stiles plays football and basketball with us here today as well. We also have coaches joining us. First, I'd like to introduce Adrian Tolentino, coaches boys tennis at Olentangy Liberty, for joining us. Shayla Glover, coaches girls golf at Olentangy Liberty. She is here as well. Thank you very much. And joining us also is William Gray, coaches basketball at Independence High School. And Jay Sherritt, coaches football at Pickerington Central. Finally, let me introduce Bill Darling. Full disclosure, he's also our son-in-law, father of 6 of our grandchildren. More importantly, longtime coach of cross country and track here at Thomas Worthington. During the pandemic, as you can imagine, I heard firsthand from him some of the challenges faced by coaches and faced by athletes. Bill?
Thank you, Governor. It's a pleasure to be here today representing high school coaches, representing my high school. As I said, I'm the son-in-law of the governor, and so I coach cross country and track here for the boys at Thomas. At the start of the fall season, we let them know, the kids that came out for cross country, that based upon my family relations, that if they were expecting a coach that wasn't going to follow the Ohio Health protocols, they probably needed to find a different sport, because that wasn't an option for them. But the first thing that we noticed in the fall was that we had about a 40% reduction in the number of kids that came out for cross country. We normally have over 50 kids on the team. We had somewhere in the neighborhood of about 32. And that was a sad moment for me. We believe in our sports. We believe in our program and the lessons and the values that it teaches. And we feel that we help them prepare for the challenges that life is going to throw at them. And to have, approximately 40% of those kids just decide not to participate and miss out on that experience was discouraging for us. They had numerous reasons. Some of them were afraid to get COVID. Some of them were afraid, obviously, of passing it on to a loved one, a family member. And some of them just thought it didn't sound like a lot of fun, worrying about getting sick and worrying about disease when you're trying to participate in a sport. And to a certain extent, that was true. It was a stressful season in the fall, having the cloud of COVID over your team, worrying about public health, worrying about the people in your communities, people with disabilities, the elderly. Are we doing everything we can to make sure that people are staying healthy? And it's just not usually part of an external focus like that, part of sports. It was a different season. We were grateful for the season, but we weren't able to have a camp like we normally do. We weren't able to have an overnight or team dinners, a lot of the things that build the culture of a team. And all of our meets were different. We had much smaller meets down here on the flats at Thomas Worthington. We had dual meets and tri-meets where normally we would go to big pageantry-filled cross-country meets with 300 or 400 kids going to the line, and kind of a thundering herd going through the forest. And those are exciting times. And it was just much smaller and kind of hurried, and everyone was kind of worried about the challenge that faced us. The spring, though, I would say the spring was much better. When we started coaching track, the vaccine had arrived, and we were excited to get outside around the 1st of March and start coaching track out here. And instead of the numbers getting worse every week, the numbers were starting to get better, and the amount of people that were getting sick was falling, and the hospitalizations were falling, and a lot of that was just due to the vaccine. I remember the first kid that we had, he took part in one of the trials. He was the first kid I had to have a vaccine. We were excited to even have one kid who had just started down that path. And every week, as opposed to cross country, every week in track, it just got better. I mean, the weather was getting warmer, the numbers were going down, the percentages of Ohioans that were vaccinated was going up. And it was so wonderful that at some point you just realize I'm focusing a whole lot more on track and field. I'm focusing on my 4x100 meter relay handoffs than I am on all the protocols that we were asked to follow. And so by the end of the track season, it was just such a different culture and atmosphere to it. It was almost normal. Being a track coach in a pandemic. But late in the season, we did have, out of the blue, one kid who came to me and said he had tested positive for COVID. He was a freshman who wasn't at that time eligible for a vaccine, and it just a reminder that it was still around, and his season was ended by that. He was having a great season, and it was just kind of a stark reminder that there are still challenges that we face. So I'm looking forward to this summer and this fall, but we do want to encourage everyone, especially the high school kids that are now eligible, to make sure that you do get vaccinated, and that you give your team every chance to have a successful season. We want all the numbers to come back up. We want to have a full complement of kids that are out participating in these wonderful high school programs that we have here in the state of Ohio. So that is my message for the high school kids out there, and to coaches to encourage their kids to make sure that everyone go out and get a vaccination, and so for the overall public health and for the ability to have a wonderful season. So thank you, Governor, for this opportunity. I now have the honor of introducing our next guest from one of our rival high schools, Shayla Glover. She coaches golf at Olentangy Liberty High School. Coach Glover.
Good morning, everyone. I am Shayla Glover. I am the girls golf coach at Olentangy Liberty High School. I have the pleasure of being able to speak today. I would like to thank once again all of the athletes that are here to participate. I would also like to thank the governor, as well as my own athletic director, Darren Meeker, as well. As Coach Darling was talking, made me realize a lot of the changes that we have seen over the past year in regards to COVID. I coach the girls golf team. It tends to be very much a socially distant sport. But we were still impacted by COVID. We were unable to have our usual team picnic at the beginning of the school year, at the beginning of the season, to get together and get to know one another on our team. We usually hold about 14, 15 girls, players on our team, and we just weren't able to meet with everyone at the beginning of the season as we normally do. COVID affected our fundraising opportunities that we do. COVID also impacted team dinners as well as our banquet. The end of the year and the end of the season is when the girls and their parents have the opportunity to come together, and we as coaches get a chance to celebrate all of our student athletes. And unfortunately, that was different this year. We had to do a virtual online banquet, and while it was a placeholder, it just wasn't the same. We were able to honor our athletes, but not in the full effect that we would like to do that. And the opportunity of our student athletes to have the vaccine will definitely change that. I think it's important to protect not only our season, our players, and our coaches. I encourage all of our student athletes to get vaccinated. While golf is a low-contact sport, anything can happen, such as what we saw a couple of weeks ago during the Memorial Tournament just here in Dublin, right around the corner from here. Athletes that are vaccinated don't actually have to quarantine. And vaccination alleviates much of the stress and anxiety from our student athletes and from coaches and from players and parents. The players want a season. Coaches want a season. Parents want a season. Everyone in Ohio wants these players to have an opportunity to have a season. And we can have a season if we get vaccinated. So I'd like to encourage everyone to do that. I myself was able to get vaccinated very early as being a teacher, and I'm very thankful for that opportunity. Right now, I would like to introduce our next player coming up, Sunny Styles. Thank you.
I want to say thank you for the opportunity to be here today. I'm Sunny Styles. I play football and basketball at Pickerington Central. I am an upcoming junior. And for me, getting the vaccination was a no-brainer because I remember last year during our football season, it was always a worry about testing positive or contact tracing. You know, you didn't want to be that guy that would end your teammate's season. So it was always a big worry for me. And then when basketball season came around, we actually did have to sit out as a team due to contact tracing. And then also for me right now is a big recruiting time for me, and I've been going to schools all over the country, and I want to be able to keep these schools safe because I know they want to have a season as well. And for me personally, me and my whole family, we are vaccinated because I know my older grandmother at home. The past year we haven't been able to interact with her very much because she's always been worried about getting it, and you know we were in school, and so we were around it and we were exposed a lot. So now that we're all vaccinated, we're able to interact freely, and I'm just looking forward this year, so we can compete and compete safely. You know, you don't have to worry about that anymore. You know, I encourage all my fellow athletes to get vaccinated, so they don't have to worry about it either, and we can all compete. And I'm just looking forward to having a lot more fans in the stands this season. Thank you. Oh, now introducing Tate Beagle.
Hi, I'm Tate Beagle. Thank you for the opportunity to be here today, and I'm going to be a junior here at Thomas Worthington, and I play lacrosse and field hockey here as well. And I just want to say, like, by getting the vaccination, it has made my teammates and I feel more safe, like playing in the games, and like they said, team dinners and like games, scrimmages, all that. And also it has helped us by not feeling like scared or like unsafe while playing. And I don't know, just get your vaccination. It helps so much. Thank you.
Thank you to the athletes and coaches. We'll now open it up for questions to anyone that's here.
Well, I don't know of any player we had that refused to take a vaccine. We had a lot of players in the fall who had friends that tested positive and they voluntarily quarantined. And in most cases, it was it ended up being that once they were awaiting test results and they were able to come back. We just followed the rules and the protocols that were set forth by the Columbus Health Department. And so, we explained to the kids that these are the rules and we're going to follow them, and there will be no exceptions. And, if we were operating under the, perception that the season could end. If too many of our kids get COVID, that's going to be the end of the season, and that's why we needed to do everything we could. One of the things we stressed to them, and I think a lot of coaches stressed to their teams, was that we're not following the protocols so that we can have a season. We're following the protocols because there's a public health crisis going on, and we need to do everything we can as part of this community to make sure people are staying safe. So that was the message, and there was no option to do anything other than to follow the rules by the Department of Health. So I think the kids were great. They were compliant. They had great attitudes about it, and overall, I think we had a very successful season from a COVID standpoint. So I have no problem. I'm very, very complimentary of the kids and the attitude they had during the season. I think that at the point in cross country there wasn't a lot of testing available. But if I'd have Jen probably speak on what the protocols more were. But whatever the rules were at that time, and they changed throughout the course of the year, we followed those rules. So.
I think the only thing I would add to that is that as school districts, our relationship with our local health departments became extremely critical. So we have lots of schools here from the OCC who were working with different local health departments. We were not regularly testing athletes, but we were doing daily symptom checks. So that became critical.
Well, we have basic quarantine rules that predate the COVID, and so those rules by the local health departments are going to stay in effect. I don't know, Bruce, do you have anything to add to that? I don't know where Bruce went. I mean, is that anything to add to that? Here, no, you got to go. You got to come up here.
That's absolutely correct. COVID falls into a category of diseases that is an infectious disease, and the local health departments will undoubtedly have adherence to the CDC's guidance on quarantine.
So just to make it very, very clear, student athletes can still miss a season. They can miss days. They can miss meets. They can miss games. As we move forward, and this virus is still very, very much here, sadly, and there's a real difference between the vaccinated and the unvaccinated. Who else? Anybody? Yeah. No. We're not requiring anybody in the state of Ohio get vaccinated, but as we saw, as pointed out very well about the Memorial Tournament, an athlete can have something, that is very disappointing to them, if they have COVID or if they've been exposed to someone who has COVID. So this thing is not over yet, and we want our athletes to be able to enjoy their season, compete, and do what they want to do. Same way if you're in theater. Same way if you're in any kind of arts. I mean, these are the things that make life enjoyable for people. This is one of the things that these things make high school better and more fulfilling. And for some kids, it's the reason they can really deal with some of the other things that they deal with in high school, and it makes a huge difference. And for that to be taken away from them is just tough. And this is the way to ensure virtually 100% should ensure that you're going to be able to continue to play ball, or you're going to continue to run, or you're going to continue to be in theater, or whatever your passion is. Well, we'll continue. There's continuing reporting will be required by schools. It's a reporting issue. It's a reporting issue. Nothing more. No. Well, look. I mean, what's left is simply common sense and traditional quarantining rules that predated COVID. And, you know, the reality is that if someone comes down with COVID, there are going to be consequences because of that are not what we want, not what that student wants, not what that parent wants, not what anybody wants. They're basic health protocols that precede, you know, that go back decades. So no, I'm not concerned that they're going to do something. Well, we issued the order last night. This came up, you know, very, very quickly. I was frankly not aware of the statute. I don't think too many people were. I'm talking now about the Ohio statute. We looked at the statute. The statute's clear, and so as soon as the federal government, as soon as the president actually, it's triggered by the president, not by Congress. Our statute is. As soon as the president made the statements he made, that triggers it, and you know, immediately at that point we had Juneteenth as a celebration. The statute also says that the governor can trigger that as well. I did that as well. As the day progressed, and we started before I was fully aware of what the statute said, my intention was yesterday to endorse the bill that was pending in the legislature, and I assumed at that point that we couldn't have a paid holiday unless the legislature took action. After we looked at the statute, it was abundantly clear that that was not true. So look, I think it's important. It's appropriate. This was the first, you know, even though it originated in Texas, you know, has gone across the country. It was really the first major observance of the end of slavery tied to a historic event. It is a reminder for all of us of the tragedy of slavery, and it is something that is part of our history. It is something that we should understand as we look at this and as our young people study this. You know, one of the things that we have seen more in our schools is, from when I was growing up, for example, is teachers pointing out original sources, looking at writing of former slaves from the point of view of what they saw, what they experienced. You know, all of those are positive things. The occasion of celebrating Juneteenth, it gives us the opportunity to look at those things. If we don't every other day, we certainly should. Gives us the opportunity to really focus on it during that period of time. Anybody else? It is. The Vax-A-Million deadline is coming up, yes. Yeah, I think it's been very successful. You know, the first week or two were just great. What we achieved in the first several weeks made it all worthwhile. Those numbers were phenomenal. First week was just absolutely astounding. We're going down. We've completely reversed that. We're going up. The second week was good. The weeks after that have not been as spectacular, certainly at all. But I think we achieved in those first couple of weeks exactly what we wanted to do. And that is two things: get more people to take the vaccination, but also move people up. People who might have gotten a month, might have gotten 2 months, getting it now plays in, and it's very, very important as we drive the virus down. Yeah, I certainly am concerned about it. I mean, Ohio, I had a conversation yesterday with, as I do periodically, with the governor of Indiana, governor of Kentucky. We were comparing notes. What can we do? It is a continuous examination that we're doing in the governor's office and in the Department of Health. What else can we do to encourage more people to get vaccination? I wrote had a conversation with our team this morning. I'm going to have another one later today. There's not a day goes by that we're not focused on this. The president has set a goal of 70%. We think that's a good goal. We're certainly not going to be at that point by July 4th, but we have some amazing people in our local health departments, our pharmacies, our hospitals, our public health clinics who are working at this every single day, and we continue to do it. So we are not done. You will see some more initiatives from us. We will be announcing some things next week, and the week after, and the week after. So we're still very, very focused on this, because we know that our ability these athletes to have a season, the ability of us to get back to school normally, not have flare-ups, depends on our vaccination rate. We are deeply concerned about the vaccination rates in some of our counties. While people move around a lot, having vaccination rates exceedingly low in some of our counties is dangerous for that county. It threatens their ability to have school without interruptions. I mean, we're not going to stop them from having school, but the natural consequence of the spread of the virus. So yeah, we're concerned. We're optimistic overall about where we are, but we certainly have pockets around the state where the vaccination rate is exceedingly low, and that is of grave concern. Yeah, go ahead. Yeah, I mean, we'll have more announcements. We'll have more things coming. I mean, look, we're not gonna stop. This Vax-A-Million has been extremely successful, and my last pitch, I guess, everyone has the opportunity to get vaccinated and sign up for the Vax-A-Million. Sunday night is the deadline. Last opportunity to win $1 million. Last opportunity to get a scholarship for your child under this Vax-A-Million program. So, still excitement out there, still opportunity to do it, and we would encourage people to do it. Okay, thanks everybody.